Hi, my name is Dr. Talal Khan from Personal Primary Care and Weight Management, and I am here to talk about men's health after age 40. Being a man who's over 40, I was surprised by how less is out there as far as men's health. You go to your doctor, have a physical, you get some basic labs, and he or she tells you whether you're fine or not, and that's it, and you repeat it every year. And I've seen so many people who have gone through the same routine and then eventually found out that they had a heart attack or some other chronic disease, and this could have really been prevented upstream by proactive care rather than reactive care. And for that reason, Khan Longevity Care, which is a program that I run, has included and focused on men's health after age 40. So what do men go through after 40? Life starts changing, our hormones start changing, and our activity, both in the gym and in the bed, is not the same. For that reason, there has been a rise in testosterone clinics throughout the United States, because everything like fatigue, weight gain, lack of mental clarity is normally attributed to something as simple as testosterone deficiency. This could not be further from the truth. Men's whole body changes after age 40, and we go through something called adenopause. There are so many factors that affect men's health in this decade of life and beyond. It's basically metabolic health, insulin resistance, insulin signaling, blood glucose levels, stress, visceral adiposity, VO2 max, which is our ability to use oxygen to make energy, and so many more things that go into men's health. This can all now be assessed, and we can come up with solutions that are tailored towards longevity and prevention of both cardiovascular disease and restore wellness, balance, and strength. The uncomfortable epidemiology of men's health is that atherosclerosis starts at a much younger age, maybe sometimes in our 20s and 30s. And a plaque forms because of something called endothelial dysfunction, which is a problem with the endothelium, the linings of the blood vessels, triggers inflammation. Cholesterol has a role, but it is a type of cholesterol that gets oxidized, forms a plaque that may be stable, and when it ruptures, it causes a heart attack. And for some men, unfortunately, the first sign of heart attack is death. Those that are lucky get stents in, and life changes forever. The factors that affect atherosclerosis are things that could be very simple, from emotional health to how much belly fat we are carrying, to sleep deprivation, our ability to exercise in something called stage 2, which conditions us for mitochondrial health and increases our VO2 max, and chronic stress that disrupts our circadian rhythm and causes atherosclerosis. All of this needs to be considered when you are coming up with prescriptions for lifestyle, supplements, and pharmaceuticals when addressing men's health. So simply going to a testosterone clinic will not prevent you from having a heart attack or a stroke. It might give you some energy, or it might actually cause harm. A longitudinal relationship with a primary care physician who sees all of this, has the ability to measure VO2 max, which is hardly ever measured, has the ability for doing a deeper dive and looking at these tests for metabolic health, looking at gut dysfunction, microbiome health, being able to analyze sleep data from Whoop, Aura, and other variables, looking at glucose levels through continuous glucose monitors like Stelo and Libre. This is the care that men deserve and what men are looking for. Sadly, this care is overall missing in our reactive healthcare system, which would put in pacemakers, do cabbage, but do nothing to prevent it other than giving a token prescription of Lipitor. Healthcare isn't that simple. And I'm all for having these procedures once they need them, once somebody needs them. If I have a heart attack, I know I can get to a good cardiologist, but it's what's going on before that heart attack happens. The decades of metabolic dysfunction, sleep deprivation, circadian rhythm disruption that led to this. So if you're looking for a quick fix, yes, you can go on those websites and get a GLP-1 prescribed, go and get a testosterone prescribed online. But if you really, really are invested in your health, develop a longitudinal relationship with primary care physician that can champion this. And if you're interested in this sort of care, you should come see me for a consultation at Khan Longevity Care, a part of personal primary care and weight management. Till next time, Dr. Khan signing off.